welcome. My name is Dr. Timothy Gallagher,
And I'm Dr. Michael Marciello.
and we're from Marigal Medical, and we're so excited to be here, and we're so excited to be on live stream today here in Berlin, because we have a very important topic to talk to you all about today. We're going to talk to you about strategies for fall prevention. So over the next 30 minutes, we're going to go through, you're going to learn why fall prevention is such a crucial need. We're going to talk to you about some really exciting robotics technology that we have in our practice, called Honova Robotics, that helps to assess if you're at risk for fall. And more importantly, we're going to talk to you about how we can help you, improve your balance. Because if you think about fall prevention, that's really the key word there is prevention. We brought our marketing director along with us today, Reagan Clark. So she's got a wealth of information about our practice. We're a physical medicine practice conveniently located in Leominster, where we treat all types of musculoskeletal complaints. Practice is pretty unique because we combine medical care, physical therapy, and chiropractic treatment under one roof. And we have a special interest and expertise in the field of regenerative medicine for patients with arthritis, which we're going to talk to you a little bit about as we go along. So the whole goal today is for you to have an understanding of, the real importance of fall prevention, and then an easy way that you can come to the office free of charge to have this all-important fall risk assessment. So before I get started, I just want to kind of introduce myself and Dr. Marciello, get a little bit of background about the two of us. As I said, my name is Dr. Timothy Gallagher. My clinical background is actually in the field of chiropractic medicine. So I got my big jump into healthcare early in my life. I was a freshman at University of Massachusetts in Amherst, where I was a tennis player. And like most athletes, including Dr. Mike, I got injured. And my injury took place my freshman year. I hurt my shoulder. And I went the traditional route and I saw an orthopedic surgeon. He didn't think it was a big deal. He thought it was just more of a tendonitis. And he administered a cortisone injection into my shoulder. Figured I'd be back on the court playing with the team in about 4 weeks. Well, that 4 weeks turned into 4 months, which led to 8 months. And unfortunately, I missed most of my freshman year playing Division I college tennis. And basically at the end, I was packing my bags to head back home for the summer, where I was a teaching pro at a local country club. But the problem was, I still couldn't lift my arm. So in desperation, my mom and dad took me to their chiropractor, who really spent the time to do a more detailed exam. You see, the chiropractor didn't just look at my shoulder. My chiropractor looked at everything. And he came to find out that my problem actually wasn't in my shoulder. My problem was in my neck. And it was referring pain into my shoulder. He was able to use a chiropractic adjustment on my neck. And literally after the adjustment, my shoulder pain was gone. This doctor spent the time to do a full comprehensive exam, figured out my problem, and fixed it all in one day. And after that, I knew I was destined to go to chiropractic school. I was able to resume playing tennis. I finished out my career at UMass. And then I went on to chiropractic school, where I received my doctorate in upstate New York at New York Chiropractic School. I came back 25 years ago. I started my chiropractic practice in Leominster. 2 years after my practice started, I met the girl of my dreams, my wife, Colleen. She's a physical therapist. And we envisioned that one day we would have a practice that incorporated both chiropractic treatment and physical therapy to give patients the best care possible. Around 2016, there was a huge change in healthcare in the field of regenerative medicine, where you could use a completely safe live cellular injection to help repair damage from arthritis. And as a chiropractor, that really fascinated me. But to be able to utilize this important treatment option we had to find and partner with a medical doctor. And this is where I hit the lottery. I met my good friend, Dr. Mike Marciello, and I always remember back, we had a phone interview on a Friday. Dr. Marciello was at a medical conference in California where he was learning about newer alternative techniques, including chiropractic treatment, acupuncture, and regenerative medicine to provide patients with the best care possible. And it was at that conference too, that he found this very high-end robotics technology that could be used for fall risk prevention. And he was really excited about that technology. And as we went along and we joined forces, we've been able to incorporate this robotics technology in our practice. And over the last year and a half, we've been talking with senior centers all across central Massachusetts on ways that we can help them to make sure that they improve their balance and really isolate fall prevention for them. So Dr. Mike's got a very interesting story on how he got into medical school and how his career path brought him over to our practice.
Thanks, Dr. Tim. Yes, so my path kind of was more traditional in the sense of science studies and getting into academics, but I also played high school sports, into college sports. I was a baseball player, had my share of injuries to my shoulder and lumps and bumps that I had gone through also. But I have a lot of friends also get hurt on the field, and I was always interested in returning people back to their sport. How do we get people rehabilitated to actually increase their ability to function? And we all get injured in one way or another, but how do we actually get a person back feeling physically stable and strong enough to return to their sports? So as I got involved with my academics and studies, I went into college thinking about going into physical therapy or rehabilitation treatments. But I realized in finding out that through my studies, there was this field of medicine called physiatry, or physical medicine and rehabilitation. So as I pursued my academics and went into a study to think that I want to become a physician, how could I take that knowledge and back to my interest in rehabilitation medicine? Well, there is such a field, such as, again, physiatry. So I finished my medical school training in Jefferson Medical College in Philadelphia. They had a strong spinal cord injury program there for rehabilitation of high-level disability, and I got very much involved in a neurological recovery of people to get back into their lives. And so I did my then training at Spaulding Rehabilitation Hospital and learned this entire field of rehabilitation medicine, where it became much more interesting to think about, okay, why does a person come to the doctor? Well, most commonly they hurt. They complain of a pain or they've had an injury. And now we say, okay, I can become a pain specialist. And in the field of rehabilitation medicine, we do become pain specialists because we have to know what caused their pain to then try to figure out how to treat it. So I pursued this field of medicine. I chose in our specialty to stay in the outpatient world, which again leaves the spinal cord injury, the stroke recovery, the amputations in the main rehabilitation hospitals. And I started working in the outpatient setting. The back injuries, the neck injuries, the sports injuries, these musculoskeletal problems, at the same time being a pain specialist, knowing how to take care of their neurological and their musculoskeletal problems. So I started my practice, started treating numerous patients. I came into a big multi-specialty practice in Dedham and realized, gosh, I'm doing a good job at this. This is wonderful. I enjoy it. And then patients never stop coming. They never stop complaining because there's always pain. And there's always an aspect of how do I figure out to get person back without necessarily just keep on giving them another prescription. And we used prescription after prescription for nerve medicine, for pain medicine, what type of anti-inflammatory, what type of painkiller. And I realized a lot of people weren't being covered by just a lot of prescriptions. That's where Dr. Tim mentioned I went to a conference. So I did this about 15 years and I realized I got to find something else to try to figure out how can I treat my patients without just another prescription. I had all the skills of rehabilitation knowledge, physical therapy, occupational therapy, again, recovery techniques, embracing. But there was not a lot of things to do outside of the prescription pad until I started seeking alternative options. That was the acupuncture and the chiropractic and the massage and different types of ways which maybe we can get away from the traditional model and do some of this newer techniques of where we can utilize our hands, utilize the skills of chiropractic, utilize the skills of massage therapist, and maybe we can inject something a little bit different than a traditional, hey, give a cortisone injection, and that's going to cover a person to get through the little inflammation for maybe a month or two. And that's where I started thinking about the regenerative medicine and getting involved. And that's where Tim and I, again, had met, because I wanted to bridge away from this pain management process and stop writing a lot of narcotic medications for a lot of my patients who we felt that we had nothing else to do. So that's where I came into the concept of trying to do something alternative. But now we realize this is becoming much more mainstream to think about outside the box, way in which we can treat patients with our skills and not with our prescription pads. And that's where Dr. Tim and I have created this practice together.
That sounds good.
Yeah.
So why all the emphasis on fall risk and prevention? Well, fall risk is a major worldwide problem. The size of the problem is just enormous. Falls are the second leading cause of death worldwide. So adults over the age of 65 suffer the greatest number of fatal falls. So do you know anybody over the age of 65?
Yeah.
Yes.
Well over.
And it's a common cause for being admitted to a nursing home. So I'm sure in the facility where you live, one of the best things that you enjoy about your facility is your level of independence, right?
Exactly.
Right. So we want to make sure that we come up with a strategy to identify if you're at risk for fall, come up with a plan to help improve your balance so that you can remain independent and not in a nursing home. So it happens a lot. 36 million people fall every year. And of the 36 million, 3 million people are treated in the emergency room. Of the 3 million, 800,000 are actually admitted to the hospital. And once you get in the hospital after you're injured, you got to make sure you have good insurance, because the average treatment bill for a fall is $30,000. Now, most of the people that we talk to in senior centers, they're under a Medicare-based plan, which we cover in our practice as well. So that's going to cover 80% of your injury. Hopefully, you have a secondary policy that covers the remaining 20%. But in these days, sometimes that is a little difficult. And if you have to come up with 20% of $30,000, that's a $6,000 medical bill. And we want to make sure we come up with a strategy to help you from falling in the first place. 684,000 people die every year from just an injury related to a fall. So Dr. Mike, we talked about this Innova robotics, and I know, when you had first seen it at the medical conference too, you were really excited about this great technology. There's a number of different, what we call screenings or indexes. So what's the index with the fall risk? What's that called?
So the falls risk program, nicely, they call it the silver index. As we start going gray a little bit, we start becoming a little bit more silver. So the thought is the silver index is a screen. It's a risk assessment. So the way we think about the nice thing about this robotics technology, which we'll see, is that we can get an understanding of what their risk is, and then we can actually utilize it to actually treat patients to get better and improve. That's why I like the equipment right from the beginning.
Yeah, and the great thing about technology is it's supposed to make things a lot easier for you. So I know traditional fall risk assessment, so my wife, again, is a physical therapist, it would take her over 2 hours to actually do a proper fall risk assessment. And the accuracy isn't that great. It's about 70 to 80% accurate. And it's always dependent on the therapist's interpretation. With the robotics, there's a huge improvement. It only takes 20 minutes to do the full screen. It's accurate up to 95%, and it uses data to actually figure out the level of fall risk you are. But then importantly, it customizes a treatment plan, as Dr. Marciello said, for Colleen takes you through the steps to help improve your balance over time. So I want to show you a 2-minute video of the Hanover in action, what we utilize in our clinic. You're going to see a couple of examples with patients on the Hanover robotics. These patients are in the advanced stage, so they're doing the exercises kind of free form without assistance. Almost every patient that comes into the practice in the beginning is under, careful observation with my wife. She usually has a gait belt. She's right behind you going through the exercises. And as you improve and progress, we definitely see a lot of improvement, and you definitely have more independence on the robotics. But this will give you a sense of what that actually looks like.
Welcome to Movendo. Movendo Technology developed a smart robotic solution that enables a new way of rehabilitation and prevention. Over 600,000 people over 65 die every year worldwide due to falls, and 37 million fall-related injuries require medical attention and hospitalization, with an increasing burden on the healthcare system. Today, after several years of clinical studies, Movendo has created the Silver Index, a new solution that, thanks to a non-invasive screening, enables the clinician to predict and reduce the risk of falls for senior citizens. Silver Index leverages artificial intelligence together with robotics to provide innovative and unique results never obtained before. By processing over 130 robotic parameters and acquiring big data, the Silver Index can improve the risk prediction accuracy, reaching a total of 95% compared to 81% of traditional clinical evaluations. The entire screening time takes only 20 minutes, saving time for the patient and the clinician, as traditional evaluation methods can take up to several hours. Results are summarized in real time, and user-friendly reports are generated right after the evaluation. Results support and suggest the clinician in making a more effective and personalized treatment for the patient.
That's pretty cool technology, right? So the technology is awesome because it identifies if you're at risk for fall, but really that's the tip of the iceberg. So after 20 minutes, we'll be able to let you know what your score is. In this patient example, this patient's 78% at risk for fall. But that's really when the work begins, right, Dr. Mike?
No question. I mean, we're just starting there to know, okay, now what's the problem?
Right, so this is where we shine. So in a multi-specialty group, particularly with Dr. Marciello, the guy's a genius. What we have is the ability for you to set up a visit with Dr. Marciello. We take most insurances in our practice. And then Dr. Marciello is going to take you through a full physical exam. He's going to put that detective hat on to really figure out, okay, we know you're at risk for fall, but what's causing that risk for falling? Because Dr. Mike, there's a lot of things that contribute to, affecting your balance and causing you to be at fall risk.
Numerous things, without question, and it's much more beyond the say, oh, you're just getting older and that's why you're falling. But of course, that always is the case, but really we have to start chipping away what walking problem is there, what kind of mechanical aspects of things that we start looking at here. We always say from head to toe.
And we've come and we've been doing this for a long time now. So we've had some common things that come about that cause you to be at risk for fall. So one of the more common things, Dr. Mike, that we see in the office all the time is spinal stenosis. Has anybody ever heard the term spinal stenosis? Okay, so Dr. Mike, what is spinal stenosis?
Yeah, so if you look at the spine, how many people who have gotten older has back pain that's more constant? So it's an arthritic development of the spine that in the arthritic knuckles, the aspects of things getting more arthritic and stiff, the column becomes smaller in size. And those nerves that run through that center column then get constricted. So a person with spinal stenosis has a mechanical problem of their spine from arthritis, affecting the nervous system that affects the legs and attempt to walk. The person is restricted, they're often tipped forward, and they're at more risk for tripping because their legs tired, fatigued, when you're actually trying to be upright and walking.
Yeah, I think we've all seen that spinal stenosis patient when you go to the grocery store. So next time you're at the grocery store, if you see that man or woman bent over the grocery cart, okay? They're bent over because they're trying to just open up the space in the spine to get them some relief. But what happens if you're bent over, right? Your center of gravity's all off. And if you can imagine that, if you're bent over all the time without the aid of that grocery cart, well, that's going to increase your risk for fall as well. And patients often say too, you know, when you have the arthritis, whether it's of your knees or your hips or your spine, you know, there's no hope, right? The arthritis is going to get progressively worse. Well, one of the treatment options that we have in our clinic that helps to stop the progression of arthritis and repair the damage is in the field of regenerative medicine, commonly known as stem cell injection therapy. We're one of the few clinics in the region that provides patients with that treatment option. We're excited. About 2 years ago, Medicare started covering those injections as a wonderful treatment option for patients that are dealing with chronic arthritis, because if we can use something that is going to help repair the damage and then work on improving their balance and coordination, well, that's a great game plan where we're making sure the patient's getting the best care from head to toe. I think the next most common thing that we see in the office that causes abnormal balance patterns is arthritis in the hips and knees, right, Dr. Mike?
Yeah, I mean, we talk about the stability. So again, if your back is arthritic, you're leaning forward potentially, you're not moving comfortably. Well, you're definitely not moving comfortably if you get a terribly arthritic knee or arthritic hip, or all of them. And many people who get older have progression of their arthritis in each of these joints, but they're weight-bearing joints, correct? So if you can't walk comfortably because it hurts, there's a limp, there's a teeter-totter, there's a loss of strength because the person often is sitting more often, so they get weaker in their muscles and they're stabilizing muscles to be upright. And that's why we want to get beyond the pain medication, because we know these are conditions that are not going to be cured. And since they're with you, and a cortisone injection potentially might give you a very short time, doesn't give us enough window of opportunity to get a person stronger. So the arthritic knee and hip is a person who really is at risk because their walking patterns are altered, they're thrown off and not stable, and you can drag a leg, limp, and you have more chance of tripping, stumbling, or falling.
Yeah, and that's really important too, Dr. Marciello. When we design these care plans too, we want to make sure we look at the different medications that you're taking, and we want to make sure that, you know, we can work on, you know, looking for substitutes for those medications, because sometimes those medications, they'll interact, and those are the cause for your poor balance, correct?
Absolutely. Medications are common. I mean, how many people who are older typically have no medicines? Very uncommon. In our healthcare, again, you see your primary care doctor, you appropriately may be prescribed the blood pressure medicine, cholesterol medications, other medicines for your various conditions. But doctors in their specialties don't often think about the patient's medications because they other doctors taking care of that. But if we don't think about the medicine as being prescribed as being a potential reason why a person might feel lightheaded or woozy, or if they're not taking it correctly, if you don't take it in a certain full stomach or somewhere empty stomach, then they can have side effects. And those medicines may be in fact part of the problem. And then more troubles is sometimes some of the medications that I was prescribing years ago, given the pain medications, can cause problems. Given some of these medicines that might be helpful for one problem, actually cause dizziness and actually cause lightheadedness, such that they may be more risk of falling because that was prescribed. So we have to make sure we look at a person's list of medications before we think about, you know, falls prevention and treatment.
One of the best advantages you have if you come into the office as a patient at Maribel Medical is we make sure, you know, we look at you from head to toe. So oftentimes things that make total sense are completely missed in a regular routine, you know, physical exam with your primary care doctor. It's like vision problems can definitely have an effect on your balance.
I've been very fortunate to get involved with a lot of people who have impaired vision. I actually treat a blind baseball program that actually is an adaptive sport. And so we think about the knowledge of what happens when we get older and age-related macular degeneration is so common, and cataracts and glaucoma. Well, we even know, that's why we converted our slides to put a black background with a white letter in, because a person who has visual trouble sometimes can't read as easily if it's the other way around, traditional white back and then the black letters. So we're in tune to that. And if we're not thinking about a person's visual perception, we're not thinking about the way that they may see the ground or reason why they might fall. So that's always in the concept of our assessments. We may not be able to treat the eye problem, but we certainly have to identify it to get you to the doctors who can take care of it.
The other problem too is, and certainly some of our online listeners may, relate to this too, is if you have a near miss or if you fall, well, number one, you're scared about falling again, right? So what we typically see is that once you fall, you decrease the amount of activity that you do because you don't want to fall again. So that's a double-edged sword, right, Dr. Mike? Because the less activity you do, then all of a sudden you become weaker and then you fall more. So that's a big issue.
And that's why we have Colleen and our physical therapist, because we recognize that once we identify these areas that are weak on top of their condition, we need a rehabilitation. We need strengthening programs to get a person back. So the deconditioning that sets in for a person's general health, cardiovascular, pulmonary disease, or all these arthritic areas, so important to regain the strength to get out of the chair, to be able to walk across the room, come down a set of stairs comfortably and safely. No question, that's a big issue to regain the strength, and that takes time and effort.
One of the things too, and I emphasize that we look at you from head to toe. The most common thing that we do in the office when we bring a new patient in is, we take their height, weight, their blood pressure, and then we look at their feet. Okay, we have a special technology in our practices that measures the arches in the patient's feet, because oftentimes if there's an imbalance in the arches, that will cause issues with your balance. But not just from a mechanical perspective too. Sometimes the feet are completely ignored. And part of your physical exam, and one of the more common things that we see in the practice when you do your exam, is loss of sensation in the feet in the form of neuropathy, which is a major problem with fall risk, correct?
Yeah, neuropathy is a very common process, and it comes along with a lot of different diagnoses. Most commonly, a diabetic will lose some feeling in their fingers and toes and have so-called a diabetic neuropathy. Well, neuropathy means damage to the nerve endings, and when that affects the feet, you lose your balance, you lose your center of space, you can't walk a straight line, person starts walking differently to kind of maintain their position, and that nerve group of problems and diseases that come in along with nerve damage has to be identified. So we make sure we look at that for everybody, that their perception of their skin and their feet positioning are assessed as well.
And then simple things too. Do a nice assessment of the home. I always joke too, when we do these, invariably I'm making my coffee in the morning, we got this rug in front of the sink. I always catch my toe under it and catch myself. So make sure that, home hazards, rugs that may come up are more secure. Certainly broken or uneven steps, and making sure you're decluttering to make sure, your pathway is clear, to make sure you don't have any of those, accidents in the house itself.
It's very common. That's one of the most common things that people hear from their primary doctors, and again, the therapist will say, get rid of the scatter rugs. But I can tell you personal hand, my mom is currently in the rehab hospital because she fell, tripped on a rug in her house, and then disrupted, broke the bones around her artificial hip just recently. So even though I can tell her, even though I say, hey, should you move this and you got to change that, we have to constantly remind ourselves of these hazards, because we have them all over our house. And you can forget about downstairs, about the upstairs. And so all those things are, again, a concern, because we have to prevent these restrictive barriers that we're going to cause.
And that's a serious injury too. And, unfortunately, fall death rates are increasing. So from 2007 to 2016, we've seen a 30% increase in fall deaths. So at that rate, by 2030, we can anticipate 7 fall deaths every hour if that continues on at the trend that it's continuing. That's why we're so motivated to offer the citizens of Massachusetts to come into our clinic for a completely free fall risk assessment. They can go through the robotics technology. In 20 minutes, you're gonna know if you're at risk for fall, but more importantly, you'll have an opportunity to book an appointment with Dr. Marciello. We take most insurances. Peace of mind for you, and certainly going into 2023, emphasizing health and well-being is going to be paramount for you, because you know what, you have nothing to lose, right? The only thing you have to lose is your ability to remain independent, right? Number one, healthy. Number one, making sure that you don't have a severe fall that results in a severe injury or death, but maintain that level of independence, and that's really the key.
That is a good.
Well, that's it for today.